Thank you for doing everything at the hospital for like a lot, and now that you're retired, you can do whatever you want.
And Don and I are two different types of people. He's a dog person. I'm a cat person. And somehow our relationship worked. He's also a Jazz in the Valley person. I'm a Scottish bagpipe person.
Well, it's always when you get your physical and he says, "You sure you want a good friend to do this?" And I said, "You're my doctor. Today you're my doctor. In an hour you'll be my good friend again, but do whatever you need to do."
But I was also, for 7 years, Don's other wife. And being a wife to Don is not easy. I was always finding things. Here's your cup, Don. Here's your stethoscope, Don. What do you mean you don't know where you put this, Don? Yeah. That was always something that I found amusing.
It was my very first circumcision that I did with Dr. Solberg. So I was a nervous wreck anyway. Had to make sure that, you have all the tools set up, sterile fields, all of that, and then you get this sweet little angel in there. So, I was busy comforting the baby, and he was, getting ready, and so then he, got ready and he grabbed the tool to cut the foreskin. And when he cut that foreskin, I was watching everything very intently, and he cut and he went, "Oh no!" Well, panic set in with me, and I kind of saw black, and I thought I was going to pass out before I called 911, and then I thought I was going to have to go out there and tell the family that Dr. Solberg just cut their baby's penis off. And then he started laughing because the look on my face must have been one of sheer terror. And so he was laughing, and I just thought, one of these days. And yeah, that's a memory that I will take with me forever.
Often, Janelle Canier and I would say, okay, all we want to know is yes or no. And Don could not do that. He would say, well, what you have to understand first is the endoplastic reticulum interacts in the mitochondria and blah, 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 blah. Always. No yes or no, just and we would be like tuning out. We would have that, what is he talking about? But he had this knowledge that was unbelievable.
Whether it's an employee with a problem, he will sit in his chair and kicks her way back like this, and he's got your full attention, and he helps you problem solve. He's just a great guy.
I guess when I think about who Don is, I think about how he dealt with patients. He and I have sat in a room in the office together, telling a patient that they have cancer. And he was so gentle with them. He didn't use big words. He told them what we were dealing with, what the next steps would be, and always listen to what they were saying. And I really appreciated that about him. It also taught me how to do it correctly.
Thank you for everything that you taught me. Congratulations, and grandchildren are the best.
We've taken a vote and we've decided he can't retire. So he has to stay. So he'll be back here in April. Well, maybe he won't. But he has a lot of things left to do in life. So I appreciate everything you've done, Don. Let's keep the relationship going. Let's keep the Seahawks and the wine going and the get-togethers. It's been a great run and we have more to do.
And so, altogether between our personal relationship in Rotary, our professional relationship dealing with patients, our teasing each other, it was a really great time with Don Solberg. Have a great retirement, Don. As one who's been doing this for about 18 months, I recommend it highly.
If anybody wants to be like a doctor, like they're like old enough and they don't have a job and they can have a job, Dr. Don, and I teach them. And that's all.